This is a 2-minute warning. Reporters on the line, please press 1 to ask a question.
Hi everyone, welcome. I'm Mandy Cohen. I'm the Secretary of the North Carolina Department of Health and Human Services, and with me today is North Carolina Emergency Management Deputy Director Steve Powers. Lee Williamson and Monica McGee are our American Sign Language interpreters, and Jasmine Matevier and Javier Castillo are our Spanish interpreters. Before going into today's update, I want to highlight 2 changes being made to our public dashboard that will have a significant impact on tomorrow's numbers. The first change will impact our hospitalization metric. The federal government has changed the criteria for reporting COVID-19 hospitalizations. Previously, the CDC required that hospitals report patients only when they were under isolation precautions, which is typically about 21 days. Unfortunately, some patients suffer the effects of COVID-19 for a longer period of time. So the CDC has recently changed their reporting requirements. They're now requiring that hospitalizations be reported for the patient's entire length of stay, not just those first 21 days. We're making this reporting change starting tomorrow, which means patients who are in the hospital for more than 21 days because of COVID will start to be counted in our totals. As a result, it is likely that tomorrow we will see a one-time increase in hospitalizations and then a continued higher number under this new definition. The second change to our dashboard is around testing, cases, and death metrics. We're changing the time when that data is pulled for our dashboard by the DHHS team. As a result, tomorrow there'll be a one-time artificial decrease in the number of tests, cases, and deaths. And that's for tomorrow, November 13th, 2020. That means tomorrow's numbers should be viewed with caution. So a change in hospitalizations, a change in testing, deaths, and cases as we make these 2 changes to our dashboard. Okay, as far as numbers for today, as of this morning, there were 2,893 new cases reported today. There are 1,279 people currently hospitalized, and sadly, there have been 4,706 deaths. Yesterday, we hit a troubling milestone. For the first time, there were more than 3,000 cases of COVID-19 reported in a single day here in North Carolina. That's not a number I hoped we would see. The percent of tests that are positive and our hospitalizations are also inching up. I'm concerned, particularly as we head into colder weather months and the holidays, and there's going to be more gathering indoors where this virus likes to spread. That's why the governor reduced our indoor gathering limit down to a maximum of 10 people. Remember, more than half of adults in North Carolina are at high risk for serious illness from COVID. Studies are also finding that some people, including those who have had a mild illness, are experiencing symptoms for weeks or months following infection. This is not a disease to gamble with. Unfortunately, we're seeing widespread transmission across the state, and our rural communities are feeling the impact. A new report put out today from my department, we're showing that nearly twice as many new cases have been reported from rural counties compared to urban or suburban counties. The majority of these cases are in the white population and in people under the age of 49. Deaths in rural white population has also increased. It's particularly worrisome to see high rates of COVID spread in our rural counties because healthcare can be harder to access in those communities. Most rural hospitals are small, and some are already feeling stretched to their capacity limits. COVID is adding to the strain that those hospitals already face in colder winter months. So with Thanksgiving coming up, also college students will be heading home soon. To help further prevent the spread of COVID, my department is providing tests to colleges and universities across the state so that students can get tested before they leave campus and go home for holiday break. We're sending close to 75,000 rapid antigen tests to public and private colleges and universities to bolster their student testing efforts. We're also working with local health departments in some of those counties to host free community testing events near campuses. I strongly encourage anyone who plans to travel or gather with people outside of their household for Thanksgiving to get tested for COVID-19 about 3 or 4 days ahead of time. If you have a positive test, stay home and isolate. But even if you have a negative test result, it's not a free pass. Tests represent a moment in time, and rapid tests miss some cases. Students and anyone else who gets a test should still practice the 3 W's. Okay, that was a lot of information, so I'm going to recap what we went through. First, we're making changes to the COVID dashboard starting tomorrow. Hospitalizations will show an increase tomorrow due to a federal change in how they're reported. Tests, cases, and deaths will be artificially low tomorrow. Second, our rural communities are experiencing rapid growth in the spread of this virus. And third, college students should get tested before heading home, and anyone traveling or gathering before the holidays should also consider getting tested. Okay, before I conclude, I want to give a shout out to all the radiologic technologists out there. It's National Radiologic Technology Week, and our radiologic technologists are the ones who perform those chest x-rays or the CAT scans that help diagnose patients with lung conditions related to COVID. I want to thank them for all their hard work. So none of what I shared today is insurmountable. We've had more time to learn about this devastating virus, and study after study shows that 3 simple actions can keep our families, friends, and neighbors from getting sick. Wear a mask. Wait 6 feet apart. Wash your hands often. I'm asking North Carolinians to do what they do best. Look out for each other. So whatever your reason, get behind the mask. And with that, I'll turn it over to Deputy Director Steve Powers to give us an update on our weather.
Thank you, Secretary Cohen, and good afternoon. Today is day 248 of the State Emergency Operations Center activation for the COVID-19 response. A front moving through the state with enhanced rainfall due to Tropical Storm Eta has resulted in flooding and dangerous conditions in many parts of North Carolina today. Flash flood warnings remain in effect for much of the state through this afternoon, with the heaviest rains moving out of the region by this evening. The best advice is to stay off the roads today unless you absolutely need to travel. Hundreds of roads across the state are closed due to flooding, and that list of closures is changing minute by minute. Please visit drivenc.org for the latest on road closures. Don't be tempted to drive on flooded or closed roads. You don't know if the road surface is intact below the water, and you could be driving into a washout or sinkhole, or could be swept away in the current. Please remember, turn around, don't drown. Local states of emergency have been declared today in Alexander, Burke, Catawba, Iredell, and Yadkin counties. Several water rescues have occurred in these counties and other areas. Swiftwater rescue teams from the Mooresville Fire Department have been dispatched to a flooded campground near the Hiddenite community in Alexander County, where many people have been rescued and a search is on for other people who are believed to be missing. A shelter is open for the people who have been evacuated from that campground. In Charlotte, an elementary school was evacuated due to flooding, and around the state, other school systems have canceled, closed early, or conducting only remote learning today. While Ada will pass well offshore of our coast tomorrow, coastal areas can expect heavy surf and strong rip currents. No matter where you are, stay alert to rapidly changing weather conditions and make sure you have a way to receive weather warnings, like a weather alert app on your smartphone or a NOAA weather radio. Again, the best advice is to stay off the roads today and tonight and stay safe. Thank you. Secretary Cohen.
Thanks, Steve. And with that, we will open and take your questions.
Our first question today is from Brian Anderson with the Associated Press.
Hi, Dr. Cohen. Brian Anderson here with the AP. Just really quick, and then I'll have a more medical follow-up, but would you be open to considering a position in a Biden administration? And has anyone from his campaign or transition team approached you about any such opportunities? I know you're committed to the people of North Carolina, so having said that on your behalf, I just want to get your thoughts.
Brian, I am committed to the people of North Carolina, and it's a privilege to serve in public service at this important time in our state's history, our nation's history. I'd be honored to serve here in North Carolina or at the federal level if that is an opportunity. And no, I have not been contacted by the Biden team at this point, but I think it is a recognition of the hard work that we have been doing in North Carolina, even before COVID, that I'm considered amongst those lists. So I'm flattered for that. And again, yes, committed to the people of North Carolina. Thanks, Brian.
And I had a follow-up as well. Are you still hearing me okay?
Yep, go ahead, Brian.
Thanks, sorry. You mentioned 75,000 rapid antigen tests will be deployed to public and private colleges. I'm curious, with the closures at a few of those campuses, how many college students are still on campus across the state, both at public and private, and is this deployment enough to get every single college student tested, and is that a mandatory test?
Thanks for that question, Brian. So we worked with our colleges and universities, both public and private, to ask them what they needed. Some do have other kinds of testing capacity, and so these rapid antigen tests, the 75,000 that we are sending, are meant to supplement their already ongoing testing capacity. So I think they're going to use what's existing, and this 75,000 will supplement. We ask them, how much do you need? And that's where the 75,000 came from. We've already shipped out to our UNC system, and I think even today are in the process of shipping to the rest. There are a number of universities that got a direct shipment of these rapid tests directly, and again, so what we are offering them is just to supplement what else do you need, and that's totaled about 75,000.
Next question is from Will Michaels with WUNC Radio.
Hi, Dr. Cohen. Will Michaels at WUNC. Two quick questions. One is, can you explain a little bit more about the testing, deaths, and cases numbers, why they are going to be lower than they used to? Can you explain a little bit more about how they've been measured and how they will be measured? And then the other thing is, have you been able to figure out why exactly cases are surging in rural areas?
Great, thanks, Will. So there will be just a one-time decrease in our testing, cases, and death numbers tomorrow. Then by Saturday, we'll be back at what we've looked at and been used to seeing day over day. The reason is that we usually are looking at a particular 24-hour window in which we pull that data. We're shifting that 24 hours over the next day or so in order to change up our timing and to provide more time for some quality checks that we always want to do, but we want to have even more time to be able to do it. So tomorrow's window is going to be less than 24 hours, and then we'll return to that 24-hour window going forward. It'll just be a slightly different time window. So just expect a one-time decrease. Again, it's not a change in the way we are collecting the data. It's just a timing of how we pull that data, and when we sort of cut off, we're saying what is happening in a 24-hour period. So one-time decrease tomorrow, back to what folks are used to looking at by Saturday. As far as your second question related to rural and why are we seeing more spread in our rural communities, I think there's a couple of reasons that we are now seeing more spread in our rural communities. First, I think there are communities that largely were spared earlier in the year. We didn't see as much spread earlier in the year, and now the virus has hit these communities, and we're seeing that the virus is spreading more. And because we are seeing that folks are letting down their guard in some informal settings and social settings and religious settings, we're seeing this virus spread. So we wanted to highlight that today in the report we put out, just so folks know where we are concerned and where the virus is spreading most quickly. I don't want anyone to hear me saying that doesn't mean I'm not worried about our urban areas, because our urban areas continue to be a place that just from the sheer numbers put up the highest number of cases every day. Our three biggest counties continue to give us our three biggest days, our three biggest numbers of cases every single day: Mecklenburg, Guilford, and Wake County. But in terms of the rate per capita, when you look at it and you standardize that across all of our counties, we do see that our rural counties are having faster spread now. We want to make sure folks understand that so they take the precautions that are needed. Wearing a face covering, waiting 6 feet apart, washing your hands. So we just want everyone to be particularly vigilant in our rural areas, as we know that healthcare is more difficult to access as it is in rural communities because hospitals are smaller and there's less resources there. So time for us all to make sure that we are being incredibly vigilant, both in rural communities and others. Thank you.
Our next question is from Matt Mercer with the North State Journal.
Hey, good afternoon, Dr. Cohen. Matt Mercer, North State Journal. Two questions for you. First, we're getting some reports that mayors around the state are interacting with your office, very similar to, or a letter that was sent to the 36 counties. Can you confirm about that level of discussion going on with mayors around the state? And then secondly, given that a meeting of the State Board of Education said that schools, K through 12 in-person instruction has not been a driver of COVID spread, and that mainly for the most part colleges are still there. What specifically, I know it was touched on earlier, but what specifically is driving those rates now, especially since areas like bars are still being closed?
Great. So let me touch on your first question related to mayors. And we have had ongoing conversations throughout our time fighting COVID with our county and municipal leaders, whether it's our county commissioners, county managers, or our mayors. And yes, we did highlight for some of our counties of concern, it was about 30 of them, that we sent a particular letter to say, hey, we're looking at your numbers and they are worrisome. And so what is it that we can all do and work together to make sure that we're slowing the spread of this virus? I think the things I was was asking for our share on social media about the 3 Ws, work with your business community and your faith leaders to talk about the importance of wearing a mask. So there are a number of ways, I think, in which we could just raise the profile of the concern. I think that was a first step. Have them do some of the work around communicating the importance of masks and of social distancing. We also said, look, there are local authorities that they have we don't have at the state level that they could consider employing here. Some of them include things like giving themselves authority to impose civil penalties as opposed to criminal penalties for violations of the executive order. Currently, the state executive order only allow for criminal penalties, but local ordinances could create civil penalties. Things like a parking ticket, right? It's a parking ticket version of a penalty. So those are just additional tools they could consider doing. We talked to mayors about it. And in fact, great conversation to highlight some best practices that mayors are doing across the state. I talked to, for example, the mayor of Durham, where they're doing a terrific program around using COVID ambassadors, where they're working really closely with their businesses, doing trainings, doing education and outreach to help businesses who want to comply, but may need a little bit of help and a little bit of training to be able to do that. And so that's been a really great model that I have learned from by having these calls with mayors, and something that we've been able to lift up to other municipalities who are doing something similar. I know Raleigh's doing something similar, Charlotte, and others. So Winston-Salem, I know, is looking at it. So I think it's a really good opportunity for sharing best practices as well. And then your second question is about what is driving our infections. And I think you are right in that that our schools are not driving our infections, and you can see and follow along with us on our dashboard. We post when there are clusters of cases in our school systems, and you can see there's not very many. Of course, we have virus here, and there's going to be virus in our schools occasionally, but that is not what is driving our infections. What we see as driving our infections are things when people are not following the 3 Ws, when you're not wearing a mask and you're not social distancing. Often those can be in informal social gatherings, in religious settings, and others. It's why the governor took the step this week to reduce our gathering limit indoors from 25 down back to 10. I think we hope that will get at some of these issues that we are seeing in our data, but there's work to do across the board. I think in every situation we need to be vigilant. We're watching what's happening around the country, and I think we are seeing a number of our states really struggle, particularly in the Midwest and starting again in the South. They are running out of hospital capacity. They are really spiking in their cases. We don't want to see that happen here in North Carolina, and if we work hard, we won't. Thanks.
We have a follow-up from Matt Mercer.
Yes, just a quick question, just to follow up on testing. On the dashboard, it has the positive rate around the state, and then it has the county level tests. So my question, and this is something that actually came up in a meeting earlier this week, and to be honest, I hadn't thought about it. You can answer this for me. Is that average positive test an average of the counties, or is it the true statewide average?
Thanks for that. So when we do the statewide percent positive, it is a statewide average. And then when we do it based on the county, we look at where someone lives, and we do an average for those people who live in the county, so we can give information to everyone at the state level as well as the county level. It should be the same, right? If we add up all the counties together, it should equal and average out to the same that we're seeing across the state, that we're seeing in each of our counties. Remember, though, we have to adjust that for all of the population. So seeing a percent positive in a large county like Wake County, that's not going to be equivalent to the same as seeing that in a smaller county. So we have it both at the state level as well as at the county level. Thanks.
Next question is from Jonah Kaplan with ABC 11.
Dr. Cohen, good afternoon. Nice to talk with you again. I wanted to reach out to you about some of the numbers that we're seeing from the rural counties, especially because if we're looking at the rolling restrictions in certain places, right now, 2 counties, Alexander and Columbus, they seem to be top in percent positive in cases, far exceeding most of the other portions of the state. How should everyone else look at that? And should everyone else be punished when we look at the statewide data? Is it being influenced by these certain areas? And what should people living in these urban areas, the suburban areas, the Triangle and Charlotte, what should they do when they're looking at this data, and how should they apply that to their own lives, basically?
Thanks, Jonah, for the question. First, everyone in North Carolina needs to focus on the 3 Ws. My saying that there is more transmission in our rural areas does not mean that those who live in urban or suburban areas are off the hook. This virus is everywhere. It's a little worse and spreading a little faster in our rural areas, which we want folks to understand, but it really is everywhere, and that's why we all need to be vigilant. And we have some rules and restrictions put in place to keep us safe. It's why the governor, as I said, the governor reduced the gathering limit for the entire state because we are seeing virus everywhere. In our rural communities, we want folks to take that to heart, to know and look at their own data in their counties to recognize that virus is spreading very fast and that they need to take precautions. And so to really understand that masks work, that we need to be wearing masks all the time, even when you are with friends and family, I think that's the important message we want everyone to hear.
We have a follow-up from Jonah Kaplan.
Dr. Cohen, appreciate you also answering the question from my colleague Brian Anderson, taking one for the team about hearing from the Biden administration or the incoming Biden administration. I wanted to ask you, since you're not on that right now, some people on the new task force that the president-elect has put together, one member has talked about the idea of a 4 to 6 week lockdown in terms of getting it under control. And I'm wondering, do you think something like that would work in North Carolina? Is that something we need if the current trends are going in the direction where we are?
Jonah, thanks for that question. I think the governor has said repeatedly that if our trends cannot stay stable, and if we see that we are overwhelming our hospital capacity, we will need to go backwards. The question about whether or not we go do a countrywide or even a statewide full lockdown again, I think is something that we need to understand deeply. I think that at this point in the pandemic, asking folks to make that kind of a sacrifice is going to be challenging. And I think we have to just recognize that. I think we have tried in North Carolina to meet folks where they are and ask them to do simple things that don't require us making a huge economic impact. We're asking folks to do simple things that keep businesses open, that don't impact our economy. And those simple things are wearing a mask and waiting 6 feet apart and really thinking about washing your hands and doing those protocols. We don't want to go backwards. I think that would be really, really hard for us as a country and us as a state if we were to do something like that. And so I'm hoping we can do the hard work as a state and as a nation to do the things that don't have those major economic impacts. And it's wearing a mask. Mask, 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 mask. Right? They work. And if we do them all together, we can keep each other safe. So we want to focus on those things that don't have that kind of a major economic impact on our state. And I think that's why we're being so focused on it now, because if we get to that place where we have to go backwards to save lives, we will, but we don't have to get to that place.
Our next question is from Sam Walker with OBX Today.
Good afternoon, Dr. Cohen. To follow up on the schools question was asked earlier, is there a way that you're able to trace out if a trickle-down effect may be happening where a single student or single teacher has applied the virus, and then it's going, and then there's a community spread happening that way? Is there a way to do that with the contact tracing?
Thanks for the question. Yes, there is a way for us to use contact tracing to try to understand the transmission lines of infection. And I'm not saying schools will never have trains of infection. That is possible. But what we're seeing in our data is that is not what is driving infection right now. Certainly there is virus in our communities, which means we will see cases in our schools. The question is, can we make sure that we don't see transmission of that in our school system? And what we are seeing right now is folks have been doing a very good job of doing the protocols that my department have laid out: masks for everyone, screening when folks come in, social distancing, wiping down surfaces. And when they do those protocols, that we can make sure that schools are not a source of further transmission within the community. Like I said, we're going to see cases in schools because there's virus in our communities. That happens. But we want to make sure that schools are not further perpetuating the spread of that virus. And I think with the protocols we've put in place, we're protecting both our students and our teachers from further spread within those walls. Thanks.
We have a follow-up from Sam Walker, ODX today.
Regarding high school athletics, the NCHSAA says that the gathering, the 10-person indoor gathering, is not going to apply to them. And then just announced before, during this press conference was that volleyball is going to be required to wear masks during competition and practice. Can you go over some of the things in your conversations with the folks in Chapel Hill regarding the advice that your department has given them as they prepare to possibly restart athletics here in the next week?
Sure. Related to athletics overall, we do have guidance that is posted and folks can review. And we tier the types of athletics. Not all athletics are created equal in terms of risk of viral spread. So we have some low, medium, and high risk. Things that are low risk is something like tennis, right? You're socially distant, you're playing often outdoors, you're not close together. Then there are some that are the highest risk, things like football or basketball, where you are close to, or wrestling, you are close together with someone all the time. Then there's some in the middle. Volleyball, as you brought up in your question, is an example of some medium risk, soccer. And so for those medium risk activities, something like volleyball, where there is space between players, but volleyball, as you know, is played indoors. We already recommend that the athletes wear a face covering if it can be tolerated. So I support wearing face coverings when at all possible, particularly for something like volleyball, where you are indoors. Again, indoors, more risk of viral spread than outdoors. So for even these medium risk athletic activities, our department does recommend wearing face coverings while participating in those activities.
Our final question today will be from Helen Chickering with Blue Ridge Public Radio.
Thanks, Dr. Cohen. This is Helen Chickering with Blue Ridge Public Radio. I'm asking about the recommendation that people get tested before holiday travel or a gathering. We've gotten lots of questions about insurance coverage from listeners who say their insurance company won't cover unless they've been exposed. So I'd like to get your thoughts about coverage. Would you consider a more formal order or declaration that could help with insurance coverage issues? And then a second question, could you elaborate on the increase in cases in rural counties? Are there counties on your radar, especially when it comes to hospital capacity? Thanks.
Helen, great question. Let me start with the how you get your test ahead of Thanksgiving. I think it is right to say this is the first time that we are recommending a test when it's not falling in the buckets of you have symptoms or you've been exposed. So symptoms or exposed that we know we have recommended all along you should be getting tested. Now we're saying get a test ahead of Thanksgiving, 3 or 4 days before you travel or before you gather. So a couple of ways in which someone can get a test. First, you could go to one of the state-funded community testing events. Testing at those sites are free. Regardless of whether you have insurance or not, the testing is free. So you should look on our website for those free community testing sites. For those who are going to other places, maybe going to their doctor or going to a place that would typically bill their insurance, where they need to indicate why they might want to be getting a test. There's a couple of things. If you're going to a place like CVS or Walgreens, often they have a screener question that says, hey, why are you going to get this test? And for those, if you're going to get a test ahead of Thanksgiving, you want to indicate that the state public health officials told you that that is what our recommendations are. There's going to be a category for I have symptoms or I've been exposed, but there's also a category that says our state health officials have said I recommend a test. So you could use that. As far as insurance coverage, we have spoken to at least some of the largest insurance companies in our state. I'll call out Blue Cross Blue Shield in particular, and I know they are covering a one-time screening test ahead of the holidays. I have not spoken to all of the insurance carriers, so I do not know that across the board, but a number of insurers are covering that one-time screening test. And I said, as you make your appointments for, depending on the testing site, I think there are different ways for you to be able to indicate that you want the test ahead of Thanksgiving. And I'd reiterate again to go to our website and look for our community-based testing sites, which are free regardless of whether or not you have insurance. So again, hope everyone can get tested. And lastly, I'll get to your question about rural counties and which counties in particular are we concerned about. So first, I would encourage everyone to go to our dashboard. Right on the first page of the DHHS dashboard is a map of North Carolina with all 100 counties, and it gives your ability to look at compare counties side by side. You can look at how many cases have happened in the last 24 hours, 7 days, 14 days, and you can look at that cut by per capita, meaning it allows you to compare Wake County to Johnston County, even though different numbers of people live there. And so you can look at that side by side. So I'd recommend folks look at that map. And in addition, my department is working on some additional ways to look at that data to help counties understand levels of concern, including around hospital capacity or others. So stay tuned for more as we always try to mature our ability to provide the public with good information. So we hope to provide even more as we go forward in the future. Okay, was that our last question? Okay, terrific. Well, thank you for the great questions today. Remember to stay safe on the roads out there, and if you can be off the roads, please do be off the roads. And whatever your reason today, get behind the mask. Thanks so much.